Dementia Researcher with a blog and a rating.
A little bit of conversation analysis can tell us a great deal about dementia. Conversation analysis, or CA, is an approach that examines how mutual understanding is achieved or not in naturally occurring conversations. The godfathers of CA, Sachs, Schegloff and Jefferson, often analysed audio recordings of telephone conversations. They transcribed the conversations and examined how turns were constructed. They observed naturally occurring breakdowns and methods of repair that are used to resolve these. Despite conversations appearing messy, it turns out that they are extremely systematic, and these systems often traverse language barriers. In fact, no matter whether speaking in Chinese or German, overlapping speech, often described as an interruption, is generally avoided with less familiar speakers and accepted with more familiar speakers. So how can CA help in dementia? It is often in the context of conversation that the first signs of dementia may be observed. It may be the topic itself, perhaps inappropriate, tangential, or difficulties in the completion of the topic, for example, incomplete questions and answer sequences, an extended word-searching behaviour, or difficulties resolving the breakdown that has occurred. This underlines conversation as a diagnostic resource, a non-invasive and plentiful pool that can provide a large data set with very little effort. Indeed, it is not uncommon that a health professional will have a sneaking suspicion about an underlying diagnosis just after a few moments of chatter. It is not uncommon that people with dementia will say they manage well in conversations with certain people, for example, friends, partners, or family members, and less well with others, certain other friends or family members or strangers even. In fact, we've all probably experienced this a little. We may have walked away from conversations and felt that they went particularly well, or another conversation may have gone terribly, and we are unsure what exactly happened. CA is a great way to understand exactly what happened, to identify how people collaborated to complete a turn or solve a breakdown, also known as a facilitator. That said, it can also highlight where people made things harder, such as asking certain types of questions that make it really difficult for the person with dementia to answer, or extending turns artificially and unnecessarily, also known as barriers. These can really impede the flow of conversation. This last paragraph highlights the applied value of CA research. By this I mean how this type of analysis can inform care. CA has informed a number of staff training and education programs. One recent example of this revealed that when staff use ambiguous language to attempt to finish an interaction, then people with dementia are often unable to follow these prompts. Secondly, CA can inform interventions for people with dementia and their families and friends working on conversations. The literature here often reveals that family members are more likely to use artificial tests or teaching type questions in routine conversation, which often cause frustration for both. This may be done subconsciously and with the best of intentions, yet once explored and discussed are often better avoided to relieve frustration and enhance relationships. In summary, if you have not previously heard of or tried CA, please give it a chance. I'm a big fan, and I feel that this could be the top of the iceberg and that CA could offer so much more for dementia. Imagine improving someone's relationship and quality of life to the point where it made care easier. This is what I believe CA can offer.
Thank you for listening. Join the Dementia Research bloggers and share your own views.